So continuing the discussion around empowering impact and diverse strategies, I'd like to welcome you all to a panel discussion on advocacy beyond borders and beyond barriers, collaborative advocacy for a world free of ALS MND. So my name is David Ali. I'm the International Alliance Advocacy and Membership Lead. And sorry, I'm a bit out of breath. And as you've already heard, the International Alliance is about global collaboration. And as you could have seen on the screen before, it's very much focused on bringing the global community together. So as part of global collaboration, advocacy is so important in bringing about change, continuing to empower impact, and there are certainly some very diverse views around and approaches to advocacy. And it's really about, as part of bringing about that change, it's also about promoting equity, justice, fairness for people living with ALS, MND, their carers and their families, irrespective of where they live in this world. So I'm going to ask each of the panellists, both physically in the room as well as Nadia and Philip, who are online. So welcome, Nadia and Philip. And each of them will introduce themselves very quickly, where they are from, and just a few words to complement their introduction. Very few words. Go, Pablo.
Okay. Thank you, David. There's some water for you. Okay, so I'm Pablo Aquino from the ALS Association of Argentina. And we, previous to this meeting, to this panel, we had some discussion through email about what advocacy exactly means, right? For those of you who don't know, I'm also a sworn translator in my country, so I am kind of language obsessed. And advocacy is one of those terms that are easy to understand in their general concept, in their very general concept, but they're not that easy to translate because there are some differences in between countries with respect to what exactly advocacy means. But we will talk about that later.
Hello everyone, I'm Reviers. I'm CEO and chairwoman of ALS Liga Belgium, but most importantly is that I'm the daughter of a person living with the disease for more than 40 years. I'm involved in the International Alliance for 17 years, and I'm also the chairwoman of EUPALS. And for me, the biggest barrier across Europe is actually not only the language, but also the difference between European countries and the access that people have to treatments, assistive devices, care, everything across borders.
Hi, I'm Gethin Thomas. I'm the Executive Director of Research for MND Australia and also on the board for the International Alliance. I'm just very interested actually to see how this conversation goes because obviously I think every country has quite different needs in the advocacy space, so to identify common advocacy topics is going to be quite a challenge. So I think that'll be very interesting to see where we get to.
Cool, thank you. I'll pass on to Nadia. Thank you.
Hi, everyone. I'm Nadia Sethi. I've been involved in many ALS-related initiatives. I lost my husband to a fast-progressing form of genetic ALS in 2020. Thank you so much for having me here. I think, having been very, very involved in advocacy since my husband's symptoms started in 2019, we hear the term collaboration a lot. My focus has always been on research and treatments for ALS. I'm hoping that we can talk a little bit about today when it's good to collaborate from a scientific perspective and maybe when it's not so good to collaborate, when individual research also can make such a big impact in kind of breaking down all of the things we don't know about ALS. So thanks for having me.
Thank you. And last but not least, Philip.
Good evening, everybody. Though it's morning out there, my name is Philip Arap Langat. I come from Kenya. Kenya is a place of, where the athletes are and a place of wildlife. Now, I'm the founder and the chairperson of the Motor Neuron Disease Association of Kenya. We try to dedicate ourselves to help the families suffering from MND. And our advocacy came from, it's a personal, a personal thing that came to me because I've lost two of my brothers in a span of less than 10 years. I lost my dad in between, and I've lost two uncles. So that's quite a number. And I decided we work on this to see how we can make ourselves, better when we are sick. So the challenges in Africa and Kenya are so immense. Not like I always tell Ali, Global South is a bit of a problem because lack even basic care, medication, and the government recognizing even this non-communicable disease. Well, we're so grateful for the Alliance for helping us to come together. Thank you very much.
Thank you, Philip, and thank you, the rest of the panel, for introducing themselves. So, first question I'd like to start with is if each of you could share with us what are the current focus of advocacy efforts in your own organisations, what has worked well, and what have been some of the challenges? So I might just continue in the same order.
Okay.
Thank you.
As I said, advocacy may not mean exactly the same in each country. I think the final outcome that we all want to achieve is to produce change for the benefits of our patients. So I'm going to tell you how we deal with advocacy in Argentina. We do have an advocacy program specifically, and that can be divided into 3 different buckets. One of those buckets is we provide support for our patients to go through the process of obtaining their disability certificate and other procedures. So we guide them through that process, through all that bureaucracy, and we support them and follow up on them. Then the second bucket is related to their relationship with their different health insurances. So the health system in Argentina, as in many countries, is kind of a hybrid. You have privately health insurances, you have publicly health insurances, and there's people that don't have any kind of insurances, and they just go to a public hospital. So when they have any problem with any of their medical insurances, where those companies don't want to comply with our local law, with our national health law, meaning they don't want to cover their Riluzole, they don't want to cover their edaravone, or any other need that they may have. So we come into play and assist them. We have a law firm that collaborates with us, and we help them by presenting and submitting some legal actions and protective actions, so they can finally be covered. So the challenge that we have is that many times the health insurance companies don't want to comply with the law. So that's why we need to support them. So that's why we need to intervene. And the third bucket of our advocacy program in Argentina is a little bit more for the long run, right? It's related to collaborating or lobbying many times with different political reference, with Congress representatives, government representatives, in order to promote different legislation that could be beneficial for our patients. For example, we've been doing a lot of, we've been thriving a lot of effort throughout the last years to finally have an ALS registry law in Argentina that similar to the ALS Registry Act that they have in the US. So that's part of that third bucket, and it's also related to advocacy. So that's how we deal with this topic in Argentina.
Excellent. Thank you, Pablo. Some challenges, but also some wins, particularly with the registry law. It's excellent.
Exactly, yeah.
Evie.
So actually, we are very lucky to be in the best part of Europe, because when I started 17 years ago, we already had a very good health insurance and advocacy policy and everything going on. But therefore, I learned also how we need to use that in whole Europe, because we see Eastern Europe is very, very difficult to have the same communication. Even have an organization involved in ALS is very difficult. So the advocacy for us is actually making sure that everybody is working together, and we are trying to do this in Europe to work together with the professionals, with INARC, with NCALS, with TRICALS. We have now Precision ALS that's going on in Europe. So advocacy is one of the most important things that needs to go on, because we still see, even in a good health insurance environment in Europe, we still have difficulties. So we need to talk about this, and we need to educate people in the right way, because we also see the miscommunications on the internet and still having a lot of questions. So that's also something that's very important in advocacy, I think. Make sure that there is no miscommunication on the internet.
That's excellent. And I think you made a really interesting point around the need to collaborate with other organisations, and with that power of strength, you can make some change. Gethin.
Thank you, David. A big focus of advocacy in Australia is around support for patients through the National Healthcare Service. We're very fortunate in Australia. The government have implemented a scheme called the National Disability Insurance Scheme that provides really significant funding for patients within that, and that includes MND patients. I think in Australia we get close to, average support package is close to $300,000 for each patient, and that can provide everything from carers to wheelchairs and treatments, etc. But there's an arbitrary cutoff in your eligibility for that scheme. If you're diagnosed before the age of 65, you can receive support from this scheme. But if you're diagnosed a day over 65, then you can only gain support through what they call the aged care scheme. The difference in levels of packages are something like average of $300,000, as I said, for if you with the NDIS, with the aged care services. The average level of support is $80,000 a year, which I know perhaps to people coming from other countries, that sounds still a fantastic level of support, but it's completely unfair that just your day of your diagnosis could be 64 years and 364 days. You're in the NDIS, fully supported, 65 years and 1 day, then you're in a much less well supported scheme. So that is a big target for our advocacy. We've been lobbying the government very hard, unsuccessfully to date. But one success in our advocacy is even within the NDIS scheme, there's quite arbitrary the level of support they provide sometimes, and they've agreed to implement a cohort of MND specific assessors who will be trained up to recognise the levels of support that MND patients need and make sure that their assessments are fast-tracked so that money can get to, that support can get to patients quicker.
No, thank you, Gethin, and that really highlights the inequity based on an arbitrary date of birth or date of diagnosis that fall into one system and be well supported financially. But if you're 65 or over when you're diagnosed, then you're in the poor cousin of the system. So that's certainly very inequitable and unfair. Nadia, turn to you.
Thank you so much. So I think there's a few things that I can speak to on this topic. So one of them, actually two of them, is disseminating good info on clinical research and science. And so I helped develop a tool for ALS TDI called ALS Trial Navigator over the last year. One of the things that's missing globally, I think, is accurate information on clinical research and what opportunities are available, and not only interventional trials, but also observational studies, right? Those observational studies are how we are all going to unlock the disease mechanisms that will lead to better treatments in the future. And so I think in developing that tool and kind of implementing it and getting it going and moving and launching it into the community, Some of the great things are now that there is a source of info broadly for people to access about clinical research. Some of the challenges I've seen is that globally, so many people are looking for access to especially interventional trials, and they face challenges in accessing those trials in other countries, even if they are willing to travel, and all of those barriers that exist for people to get to a clinical research site. So I think those are some of the things that I've seen that it would be great to address. Also, the accuracy of the info is difficult. If we're relying on global trial registries, for example, to tell us what trials are out there, and those registries aren't updated, or info, for example, on compassionate use programs may not be available publicly, though that's all information that's lacking and goes missing, even from a tool like Trial Navigator. So that's one of the ways that advocacy has helped disseminate info, maybe some of the strengths and weaknesses. Another thing that already came up on this panel is social media, right? So social media is such a powerful tool. I think we've seen a lot of advocates share information on social media. Some of it is wonderful, and some of it does spread misinformation. So how do we tackle some of that misinformation? I think the research community in general has kind of shied away from social media, from tackling some of the misinformation. But unless we all kind of step in to have discussions, and they should be reasonable discussions about what is helpful and what's not, and I think everyone can learn from each other in that kind of a space. I certainly, the science community knows very much about the disease, the trials, those things. But people at home who are facing the disease also know so much that the research community doesn't, right? So it really takes everybody coming together to tackle some of that misinformation that we see on social. And the third way I think I've seen advocacy affect change is through some of my work with the NEALS Patient Education Advocacy Committee, where we connect ALS families with anyone who's working on ALS. So it could be pharma companies, it could be other ALS organizations, but bringing that patient and caregiver voice into the design of a trial, for example, or into how an organization is conducting a project or some of their work, I think is a critical thing. I think some of the things that have worked well there is that we have been very effective in bringing the patient voice into those different organizations. Some of the downsides is that I don't think organizations and pharma companies always know how to utilize the patient voice well, and depending on their experience level, it's challenging to effectively incorporate the advocate's voice into their work. So those are some of the things that I see.
Yeah, thank you, Nadia. I know you've raised some really interesting points around information communication. Certainly in terms of advocacy, it does need to be evidence-based, and how do we counter misinformation, particularly via social media. So thank you. And Philip.
Yeah, in fact, most of the things that have been said here also hit Kenya, Africa, but our advocacy is possibly on the basic needs. Assessing essentials like beds, even in the homes, assistive devices, we got none. So we're still very far. We also affordable care. We need to push for affordable care and introducing genetic testing. If we have to do it, you have to be convinced, and it's done very far. Like the case of my brother, he had to go to the US. We also lack specialized healthcare. The doctors, the number of neurologists in Kenya are so few that we ended up going about 300 kilometers to get a neurologist. That's about 8 to 9 hours drive. So in case of emergency, it's very hard. I remember we had to rush my brother around 160 kilometers to get better ICU services. So specialized healthcare is still very far. We also talk about policy advocacy. The government of Kenya has not recognized some of non-communicable diseases like MND. In fact, it focuses only on cancer, cardiovascular diseases, diabetes. But this one is so essential, especially the way it affects. There are many, many. Those are just a few that we're working on. Now, what has worked? I'm so glad to report that partnering with the international organizations has really opened up. Even when I'm talking to our people in Kenya, we give examples of what happened outside. And we also talk about research. I'm glad one of our professors from the one who treated my brother is coming over. So we are picking up in research. Now, what's been challenging us is access to diagnosis. It's very costly and leave families very disparate. In fact, I have visited some people who just sit, wait, they have nothing, they cannot do anything because the government has not supported, and sometimes there's no money. Economic barriers, even getting the medicine, basic quality life is very hard. And then healthcare infrastructure, we lack specialized care within reasonable distance, just like I've said. It combines us, and we really suffer struggling to get those things done. Thank you.
No, thank you.
That's just a few. There are a lot here.
Yeah, no, thank you. And you really highlighted some really significant challenges that you're experiencing in Kenya, which I think is not untypical of a lot of organisations and countries around the world, which is why the International Alliance, I think, is an excellent opportunity to support Kenya and other underrepresented communities, and having people in this room and online who can also reach out and support you in terms of health systems and care and assistive technology, etc. I'm conscious of time, so I do have another question around which I'll ask the panel, and if we can limit our responses to 1 minute, that would be wonderful. And that's, what advice would you give to people in regard to how they could get the most out of their advocacy efforts? Pablo.
Well, 1 minute. Locally, many things. Of course, I can say, okay, make sure that you really know your local legislation in order to defend and promote the rights of your patients. But then internationally, well, we can make really good use and take advantage of these meetings as members of the Alliance and get to know people from other countries and other associations and get to know their resources and have conversations, and a lot of projects can start from there. Like I have Evie right next to me, and we always remember that we met here in one of these meetings. I don't know, it was 2013, I guess, and then we started collaborating and having some talks, and in 2016 the ALS Association from Belgium sent 10 motorized electric power wheelchairs to Argentina, and our patients are still using them. We are keeping them very well maintained, and they are still using them. They are really good chairs, and we wouldn't know about that if we hadn't been here, if we weren't attending every single year to these meetings. So yeah, get to know your people around the globe. Yeah.
Thank you. Evie.
Yeah, there's not a lot to add, actually. Collaborate would be one of the most important words in my end words, actually, in this panel discussion. And mostly, actually, keep in your mind for who you're advocate for the people living with the disease, and talk from your heart. I think that's the most important thing, and that's the most appreciated thing that people can have in the world. So that's the most important thing I want to say.
Beautifully said. Gethin.
Yeah, I think if you're going to talk to government, you need to come with solutions, not just problems as well. Tell them what you want, and if you can attach a dollar number to it, I think that really helps. And I agree with what Evie and Pablo were saying about working with other people. If you can bring other organisations and you all have a common theme, a common ask. Like in Australia, we have the Neurological Alliance, which is across diseases like Parkinson's, MS, childhood dementia, all working together and identifying common things that we'd like the government to change. And I think that makes a much more powerful argument.
Cool, thank you. Nadia?
I think I'll speak more to the people with ALS and caregiver viewpoint. I think some of it's already been said, to be part of scientific meetings like this, for advocates to be there and to make noise and in a good way, and to spread the word about meetings like this, and to have people attend and then share what they've learned, and to also share their lived experience with the science community, I think is absolutely critical. And that's how change happens, is by making good noise, and by coming together in these types of forums to share ideas.
Thank you. And Philip?
Yeah, I'll be very quick. Well, us in Kenya and possibly Africa, we start with the basics. We need assistive devices, affordable medication. I can even appeal here, if you have any extras of those equipment, Kenya is ready to receive. It's very sad to see somebody being pushed on a wheelchair that is half moving and half. Build strategic alliance, especially in trials. We looked for Tofacet and we could not get. If we can have people coming to also do the trials in Africa, it would be very right. We are going to engage in policymakers so that we make sure that people suffering from ALS are supported. And then we focus also on sustainable goals, things that we have, train our people so that they can support those who are sick. Thank you very much.
Thank you. Any questions? There's a question. Thank you.
Hi, my name is Jean. I'm with Genetic ALS and FCD and the Legacy. Philip and Nadia, do you guys have thoughts on how families impacted by inherited ALS could be leveraged to have a very large pool of impacted people to push advocacy for this disease?
Nadia, that was a question. Oh.
Yeah.
Was it a question?
I think
Oh, sorry. I just wanted to know, was there a question specifically for Nadia? Okay, all right, thank you. Philip, sorry.
Yeah, I think she mentioned Philip and Nadia. I would say I think I'm part of the people who need to get genetic testing, and if it's very possible, we can. But I think it requires the strength of, you have to be very strong, because if you're diagnosed, you wouldn't even know what to do.
Yeah, and I think in the US, we are also just beginning to implement genetic testing more broadly in ALS. And as we do this, more and more people are going to find all kinds of genes, right? Some that we know well already, and some that are more or less known. And it does impact the entire family. I can speak from personal experience to that. It impacts your whole future, flashes before your eyes, right? When that test comes back positive. And so, yeah, I do think that it's not a question of if this is going to be important, but when, right? It's as globally more and more people are going to get genetic testing, this asymptomatic carrier community is going to become very powerful in research in general, and understanding the disease, how it begins to actually manifest in symptoms, all of it. It's going to be a very critical piece in driving the research forward. And I think that what also comes with that is trying to understand the chance that people who carry the gene are actually going to be impacted in their lifetime. So all of that stuff needs to be elucidated, and we can't do it without the asymptomatic carrier population.
Cool, thank you. Any other questions? Any questions online? Oh, there's looks like Tanner, I think, from here.
So obviously with every country being different and different rules and regulations in place, what are your guys' thoughts and experience in partnering with industry when we look at advocacy? They're obviously a crucial partner when we look at pushing advocacy and using industry, whether it's DME or pharma, things of that nature. Do you guys have experience at all partnering outside of the NGO space with industry and advocating for patients?
Well, maybe I can answer to that question from EUPAL's side. With EUPAL's, we actually closely work together with industry partners to make sure that everything is covered in Europe. So I think it's very important because you see different kind of angles that you need to tackle. Also, the industry perspective is very important to include in advocacy and to use it in advocate just at regulatory environment to make sure that also their angles are tackled to make sure that we come on the right way to the right pathway to the patient.
Any other comments on the panel?
Yeah, I think in Australia we've had a lot of discussion around the review process for health technology, so drug approvals, etc. And obviously the pharmaceutical groups have been very strong in that space, and also the patient groups. But I think it's also important that we work together on many aspects of that. It's important also that you step back, as Evie was saying or Nadia, about always think about who you're advocating for. And sometimes when you work with industry, there's really obvious common themes, but you also have to remember sometimes that you need to step back sometimes as well and make sure you are representing your community as well as what the industry might like.
Maybe just to add to you, it's really finding the right way to do it. Find the right angle to communicate with industry, but make sure, like Gethin said, make sure that you come up for your community and keep that in your mind. That's really important.
In the case of a country like Argentina, Argentina is not a hub for ALS. It is for other diseases, but not specifically for ALS. So sometimes we work as a satellite and we depend a lot on what's going on in North America or in Europe. But sometimes it takes a lot of effort to bring at least 1 or 2 clinical trials in Argentina, which we did. We had a couple of them, and it's a great victory when we can participate in one of those international clinical trials. But yeah, we definitely need more, and yeah, we work with the industry. We work with our local neurologists that sometimes they are flooded with a lot of work with other neurological disorders, and they do what they can. But we do have good human resources in Argentina, and the couple of times that we had clinical trials in Argentina, they worked pretty well, and we had very good, very strong enrollment, so we are looking forward to having more of those international clinical trials in our country and in our region in South America. Yeah.
Thank you. We've just got time, very, very limited time for one more very quick question and quick response. Kathy.
Sorry, I know I have a complete bias here. I'm actually going to ask our moderator a question, and sorry to put you on the spot. But I just wonder, David, if you could address the link between the local advocacy on all 5 continents that we've heard today and the advocacy work that you participate in at the global level.
I wish I'd picked somebody else to ask a question. Look, I think there are advocacy, as we've heard through this panel discussion, there's advocacy happening in our local countries in many different ways. But I think what sort of ties it together is some of the advocacy effort that the International Alliance is undertaking, particularly with organisations like the WHO, the World Health Organization, the World Rehabilitation Alliance, and the World Patients Alliance, which we're sort of actively involved in all of those. And it's really about sort of taking some of that, like particularly with the WHO, and they have these frameworks and For example, they've got the rehabilitation strategy of 2030 and also the intersectorial global action plan on epilepsy and other neurological disorders. So they provide a really good framework for advocacy at a global level, which then translates down into a country level, because each country actually has a responsibility to report their progress against that action plan. And so the Alliance is going to take a much more active role in regard to supporting its members around advocacy within those sorts of frameworks, and particularly also with the World Rehabilitation Alliance, where we're very actively involved in a number of their working groups around primary care, emergencies, workforce, and research, and a bit of research particularly around health systems, which sort of picks up the point that Philip made with some of the challenges he's got. So I've just got the wind up, so thank you.
You got it.
Thank you for this great discussion. Okay, so this brings us to the end of this section of the program.